For me, this treatment has changed my life completely. I mean, I've struggled with this for 19 years, and this is a big deal to me. This is my body, and along with my body comes my heart and my mind and my soul, and being able to look at that in the mirror and not be sad about it is a wonderful thing for me.
The emotional impact of psoriasis and vitiligo is significant. Skin diseases, unlike internal conditions, are visible to everybody. So psychologically, when you walk into an interview or a high-pressure situation and you've got something on your skin, it's quite bothersome.
I've had vitiligo for about 11 years now. I was diagnosed at age 18, of course, with just a couple of spots. I believe it was on my hands and around my eyes at that point. And I guess I was kind of hoping for the first year or so that it would go away, but of course it's a progressive disease and kept getting worse.
One of the joys of dermatology for me is the ability to practice phototherapy. And I remember a patient who came in after many sessions who was in tears the first time she started phototherapy. And after around 15-20 treatments, came in to see how she was doing. She jumped up out of the chair and showed me her tummy and said, "Look, it's all gone."
For me to be able to get up in the morning or get out of the shower and look at myself in the mirror and see nothing but smooth skin, no red splotches, and to be able to touch my skin and have it be soft and not bumpy and red, those things for me has changed my life. I mean, it has really, truly changed my life.
I think without having psoriasis or vitiligo, it's impossible to understand what these people go through. It's terribly emotionally trying for them. And for the first time in their life, their skin is clear, their skin is the same color, all the same color, and they can walk around in bathing suits, they can wear fancy prom dresses, they can go into the swimming pool.
Phototherapy is basically using different types of ultraviolet light to treat the skin. And there are three types. The oldest type is broadband UVB, which has been around for years. It can treat psoriasis and vitiligo, however it causes a fair amount of redness and it takes many sessions for it to work. It doesn't work in patients with really hard to control diseases. So that's the oldest type. The second type is PUVA, which is a newer modality that actually is derived from ancient Egyptian technology, where you take a pill and then you're exposed to ultraviolet A type of light. It works very quickly, works very well. However, over several treatment sessions, you do increase the chances of developing premature aging of the skin and skin cancer. The third option is the cutting-edge form of type of phototherapy, which is called narrow-band phototherapy. Narrow-band phototherapy combines the benefits of PUVA in rapid clearance and working very well in patients with the benefits of broadband UVB, where you don't have as much of a risk with skin cancer formation and premature aging of the skin. So narrow-band UVB is the newer technology. It works rapidly and it works well in patients without as many side effects as PUVA.
Once I started the treatments, 90% of my body that was covered was healed. I only had a small part that I had to continue the treatments. It's a very easy therapy. Nothing scary about it. Even I find, for the concern about the white spots showing up a little bit more with vitiligo, I find with consistent treatment, they actually sort of change from being stark white to almost a more ruddy, sort of creamy tone, which, hey, I'd rather take over stark white any day.
Home phototherapy is an option for patients where they can deliver the light dose themselves. And for patients who are experienced with phototherapy, I think it's a good way to treat them. Basically, the patient will receive a unit and the company will tell them how long each light dose is given. However, it needs to be done under the supervision of a physician, because if you overdo it, you do increase the risk of developing skin cancers and premature aging.
We get a lot of telephone calls because we advertise in organizations that psoriasis patients belong to, vitiligo patients belong to, so and I guess we offer a solution to them. And a lot of these people have gone a number of years without any kind of solutions. They don't know what the solutions are.
I tried other treatments. I tried laser and that didn't work, and I tried all the other newer technological treatments and nothing was working, and that's when I started the
the phototherapy.
Sometimes the telephone calls we get are people saying, geez, I didn't know you were out there. I didn't know there was any kind of a therapy. Does this really work? And one of our jobs is to work with these people to tell them about the kinds of therapy that we sell.
And I've tried vitamins, I've tried creams, things like that, but it's the only treatment that I've used that brought back pigment quickly and just really in dramatic results.
Psoriasis and vitiligo have a common pathogenesis, meaning the way they develop probably have a link, and that is they're related to the immune system. The immune system becomes hyperactive in both conditions. In psoriasis, it's probably CD4 lymphocytes, and vitiligo, we're not quite as sure. As a result, you have treatments that are shared between two roughly different diseases.
Narrowband phototherapy is well accepted by the dermatology field as being probably the treatment of choice for people with moderate to severe psoriasis. And more papers and documentation is coming out on vitiligo as well.
It's a little personal for me because of myself having psoriasis. I see the patients who are so frustrated with the creams and so upset and kind of have a lot of anxiety about their condition, and then they come in and then they get better and like, oh look, see, I'm getting better, and it just makes you feel good about yourself, like, I know I'm helping you and I'm so happy for you that this is getting better for them. I know it's something that it's not going to cure them, but it's helping them feel better about themselves.
First and foremost, treating with phototherapy really, it gave me control over my condition. I haven't had one new spot the entire time, which is really significant for me.
If a dermatologist is watching you carefully and guiding you through this thing, any side effect that you may be presented with can be taken care of by a dermatologist.
Sometimes patients have questions on what doctors prescribe this. I don't have a doctor that will help me prescribe, and I can usually get them a list of doctors in their area.
If their dermatologist is not familiar with this kind of therapy, contact us. We know dermatologists from one end of this United States to the other, or one end of this world to the other, that are experts in phototherapy, and we can put them in touch.
Some doctors will call me and ask me what kind of unit is best for them.
A good part of our job here is to talk to them about insurance coverage and to help them get insurance coverage to buy this kind of equipment. And if I can say we got a pretty good staff doing that, I mean, they really go to bat for these people. They seriously do. We don't take no for an answer.
We call the insurance companies, we'll file the claim, and we'll keep checking up on it. It's usually about a 3-month process.
One of our objectives is to provide a nice looking unit. The largest is the UV 360 series, which is a full body cabinet where the patient actually steps into this cabinet for full body treatment. We have the 700 series, which have lamp complements ranging from 4 lamps to 10 lamps, so that you rotate to be able to treat your whole body. If you've just got localized disease, we also have a series called the 244 series, which is a very small 2-foot size of unit that's very good for treating the shins, say, the arms, the elbows, the face. So we have quite a range of products. We also have a spot treatment unit called the DermaPal, which is just a little handheld unit, looks like a little telephone. Very, very high intensity. And you can use that very effectively for treating spot treatments of both psoriasis and vitiligo. And it also has a comb that you can slide onto that thing. So if you have particularly psoriasis is very predominant in the scalp, you can use that to treat scalp psoriasis.
There's nothing better than starting some sort of treatment program. Because this is my experience using phototherapy, I would recommend that to you. It makes you feel so much better to have control over your condition, to be doing something about your condition.
It is giving me back my self-esteem, my self-confidence, and it's just made me, feel beautiful again, and it's just made me a whole person again.